So good afternoon and welcome to the 2020 AIDSWatch session on Black women and HIV. First, my name is Tony Young. I'm the Executive Director and founder of Community Education Group. We have offices in Washington, D.C. and in Shepherdstown, West Virginia. I'm very excited about this opportunity to share with my panelists a conversation about the importance and the role that Black women play in HIV/AIDS policy in the United States of America. Before we get started, I think we should do some brief introductions for our panelists, and then we'll come back and begin our session. Let's start with Kenita Seeley.
Yes, good afternoon. Thank you for having me. My name is obviously Kenita Seeley. I'm Policy Counsel for the Black Women's Health Imperative, and thank you.
Thank you very much. Tammy?
Yes, thank you for having me as well. My name is Tammy Boyd, and I am Chief Policy Officer and Counsel for the Black Women's Health Imperative.
Thank you very much. Dr. Burns?
Good afternoon, everyone. I bring greetings from World, Women Organized to Respond to Life-Threatening Diseases. I'm Dr. Demisha Burns, the Policy and Advocacy Manager, and just wanted to say hello from Executive Director Carla Dillard-Smith, our staff, our World Leadership Committee, and the Bay Area. We're very glad to be here.
Thank you. Nikisha?
Hello, everyone. Thanks for having me. I'm Nikisha Powell. I am the HIV Program Manager with the Black Women's Health Imperative.
Thank you. I think what we're going to do is that we are going to, in this era of COVID and being online, we're going to go through our presentations. And then what we'll do is if we have some questions and answers at the end, we'll answer those. So Kenita, are you going to lead off the Black Women's Health Imperative section, or?
No, I believe that is Nikisha.
Nikisha, go for it.
Could we get the next slide, please? Oh, wow.
Can you see it, Nikisha?
No, it's still on the main page.
Oh, it's still on the main one. My apologies.
Not a problem. While we're queuing that up, just wanted to get a little background on the Black Women's Health Imperative. We are the nation's oldest and leading organization that focuses on the advancement of health for Black women, and that's across the lifespan, including policy, advocacy, education, research, and leadership development. So for our nation's 22 million Black women, we serve as a conduit for all public health information as it relates to Black women. In 2017, as it relates to our HIV programming and initiatives, we launched On Our Own Terms, which is a collaborative model, including national organizations that work together to look at the gaps in policies, programming, and practices for Black, cis, and transgender women. And so what we've done is we convene and we look at all of these things and create products that other CBOs, other ASOs, and organizations that focus on women's reproductive and sexual health can use. Next slide. Our steering committee is a group of national organizations that lead the way in informing the materials that we create for dissemination. That's AIDS United, the AFIA Center in BLACA, which is now National Black Leadership Commission on Health, NITAG, New York Transgender Advocacy Group, Positive Women's Network, and World. And we also have a series of advisory members who also support and disseminate the work that we create. Next slide. Our most recent product that we're very proud of is a creation of a comic book series. What we've noticed in our research and focus groups and surveys is that while there's lots of HIV prevention messaging, there's not much messaging that focuses on the prevention of HIV for Black women. So we're often left out of the conversation. And to fill this gap, we created Luna Unleashed. And Luna is a 25-year-old African-American student nurse who is a student by day and a super sex educator by night. And so she covers, she's trying to save the world and look at different barriers to access to healthcare, reproductive health, and things like that. And so we've launched Luna just last month in commemoration with National Women and Girls HIV/AIDS Day. We will be launching 4 more issues before the year is out.
Here,
I will turn it over to my colleague to talk about some other resources that we have around HIV prevention and education along the policy line.
thank you, Nikisha. So Black Women's Health Imperative recently released 2 public policy publications that focused on HIV. The first one is the Black Women Vote National Health Policy Agenda. And we released that agenda, legislative agenda, to build upon Black women's political influence, ballot power, and commitment to civic participation. And that agenda was based on 4 pillars: access to quality and affordable healthcare, equitable responses to public health emergencies, sufficient diversity in clinical research, and increased funding to support HBCUs. And one of the reasons which was really the impetus for us doing a more deep dive, was that we saw that there needed to be a focused policy agenda around HIV. And so we released the HIV policy agenda focused on Black women. Next slide. And similar to the more general publication we had, we addressed HIV, but here we had a deeper focus. This one had several different pillars. We had prevention, where we looked at stigma and discrimination, HIV testing, knowledge of PrEP. We also focused on young people and HBCUs, as well as reproductive health. Then there's a second pillar in the agenda around access to care, which would be like your Medicaid, Medicare, the Y and Right program. We also even looked at some more innovative approaches, such as online pharmacies. And then we also took into account some global considerations as well. And then we wanted to address, Black women living with HIV. And so this is not meant to be an exhaustive list, but we looked at housing, employment, HIV criminalization, and immigration. And you'll hear from my colleague, Kanita, more about the HIV criminalization piece. And I'm gonna focus on the HIV testing and the PrEP aspect of the agenda. Next slide. We all know the alarming stats around HIV prevention. And as you know, Gilead is currently the only provider of PrEP, and it goes under the name of Truvada. And we wanted to look at PrEP as an HIV prevention strategy that can be used by both men and women when taken daily as directed. And so we looked at but we wanted to do more of a analysis of why, in terms of HIV prevention, there's still stats out there. And as we know, and studies have shown that Black women still do not know about PrEP. And we, of course, know there are many factors that go into the complex problems around Black women that Black women face that would prevent trying to prevent or live with HIV. I mean, such as many of the social determinants of healthcare, racial, social, and health inequities. And these are just some of the stats. 87% of Black women newly diagnosed with HIV contracted the virus through heterosexual sex. 1 in 48 Black women in the US will receive HIV diagnosis in their lifetime. And then PrEP can reduce your HIV risk of reduce your risk of HIV infection by more than 90%. And I believe you'll also hear a little bit more about PrEP and the access issues there. And next slide. And so HIV testing remains, one of the most critical tools in the fight against HIV. And, currently, as we're talking now, we all have seen the importance of testing, even in terms of when we look at like the COVID and the focus on, making sure we test so we can actually know what is going on. And so what we did, we provided policy recommendations around that. And BWHI recommends funding for more focused research on strategies for reaching and engaging Black women in HIV testing and prevention efforts. And then we also recommend legislation that will fund efforts to determine the best practices for reaching and encouraging Black women, especially those who are at an increased risk of acquiring HIV. And next. And again, as I mentioned, the COVID piece, there have been several different iterations of COVID legislation that have come out. The most recent was the CARES Act. And as we're speaking, the Senate passed a COVID bill on Tuesday, and the House is expected to pass the fourth COVID bill today. But this particular section is around the CARES Act, which was the stimulus package to address some of the COVID crisis. And this is, even more important as we're hearing that African Americans are disproportionately impacted who actually are infected with COVID. And so some of the things that we did, Black Women's Health Imperative, along with AIDS United, sent a letter to Congress underscoring the unique risk around COVID and that it presents for people living with HIV. In the bill, there was $90 million for the Ryan White program, $65 million for housing opportunities for persons with AIDS. And then also the Medicaid, Black Women's Health Imperative, other organizations sent a letter and really raised awareness around excluding nonprofits who receive Medicaid was adjusted so they wouldn't be penalized for Medicaid reimbursement and they would be able to sort of access the funds, the COVID-19 stimulus funds. And then I'm going to turn over to my colleague Kanita to discuss the HIV criminalization piece.
Thank you, Tammy. My presentation focuses on HIV criminalization and how it limits access to care and treatment. HIV criminalization is the practice of utilizing state laws to prosecute and punish an individual based on their HIV status. For decades, these laws have served to refute medical fact and disregard advancement in treatments, deviate from generally accepted criminal law principles, conflict with public health policies, and it has stigmatized and discriminated against people living with HIV. It is important to note that research demonstrates that HIV-specific laws do not reduce transmission, and a growing body of research shows that they may fuel the epidemic because it increases stigma, discourages testing, and makes it more difficult for people living with HIV to disclose their HIV status. In fact, states that have harsher HIV criminal laws typically also have higher transmission rates. Next slide, please. When these laws were first promulgated, the understanding of the disease was in its infancy. If someone contracted HIV, it was really considered a death sentence. As you know today, with research and advances in modern medicine, many people can live near normal lifespans as long as they have access to quality healthcare. Despite the fact that the routes, risk, and the likelihood of transmission are near zero when correct and consistent condom use and effective antiretroviral therapy are in place, HIV-specific laws do not require proof of a person's intent to cause harm or to transmit HIV for a finding of guilt or a factor in determining the level of punishment. Further, these laws do not treat condom use, an undetectable viral load, or the extreme unlikelihood that transmission will occur as evidence of lack of intent to harm. In fact, HIV transmission is rarely a factor in HIV criminalization prosecutions. Even extremely low risk or no risk sexual activity without disclosure is subject to equally serious charges and sentences. Also, contrary to scientific fact, saliva does not transmit HIV, yet still many states criminalize spitting and biting with prison sentences as long as 35 years. Next slide, please. This graphic, sourced from the Center for HIV Law and Policy, shows an overview of the HIV-specific laws in this country. As you can see, 34 states have HIV-specific criminal laws and/or sentence enhancements applicable to people living with HIV. That equates to approximately 70% of the country having laws like these in effect. But who is affected by these laws? Next slide, please. As you know, the majority of women living with HIV in the US are women of color and low-income women who consequently live with the compounding effects of trauma resulting from HIV-related gender and racial discrimination, along with the discriminatory practice and policies of the criminal justice system. Then it really should come as no surprise that studies have shown that HIV criminalization laws disproportionately target and harm women of color, particularly sex workers and women of the trans experience. Next slide, please. Based on all these factors, BWHI recommends that every person must activate and call their representatives in Congress and state legislators. The legislation listed here aims to combat HIV criminalization. On a federal level, with the Pretrial Integrity Safety Act, which would provide grants to states to assist in eliminating the use of money bail as a requirement of pretrial release in criminal cases. Repeal HIV Discrimination Act calls for the review of all federal and state laws and regulations regarding the criminal prosecution of individuals for HIV-related offenses. It means to revisit all these laws to ensure that there is no additional burden placed on individuals based on their HIV status, and among others, make sure that the laws are public, health-oriented, evidence-based, and medically accurate. On a state level, again, remember that HIV criminalization is largely a matter of state law. We must advocate to our state legislators to get these discriminatory laws repealed. Locally, BWHI supports the Community Safety and Health Amendment Act of 2019. This legislation was introduced by Washington, D.C. City Council and seeks to decriminalize sex work in the district. As you know, the Black woman's voice is very important and forms a formidable voting bloc which can be wielded during elections. I'm confident if we unify, we can begin to overturn these unjust HIV laws. Thank you.
Thank you very much. I was on mute. I think my slide presentation is up next from Community Education Group. Is that right, Laura? Next slide. I could just start talking about Community Education Group.
Sorry, I'm pulling it up right as we speak.
I mean, in the era of COVID and teleconferences, I think this is what we all have to kind of get used to. As I said earlier, my name is Tony Young. I'm the Executive Director and founder of Community Education Group. We are, like I said, located in both Washington, D.C. and in Shepherdstown, West Virginia. And we are an organization that is a hybrid in many, many ways, in that we do global work, we do national work, and then we do work at the local state policy level. Community Education Group was founded in 1994. Our original name was the National Women and HIV/AIDS Project. From that point on in 1996, we changed our name to Community Education Group to be more reflective of the work that we did and that we do. One of the important things that I wanted to talk about today is Black women in PrEP, and is it an awareness issue or is it an access issue? Next slide, please. There you go. I borrowed this slide from a presentation from Dr. Anthony Fauci. where we want to talk about treatment and prevention and where is the access point. One of the things that we know, as one of the previous panelists stated, that with PrEP, we have two tools now. We have Truvada and we have Descovy. Descovy is not black box labeled or labeled for use in women because of some challenges around the study and data collection for its use with individuals born at birth as female. And I think this brings up the issue of PrEP access for Black people, PrEP access for Black women, but also access for individuals who may be transgender but born female at birth, and then who have now transitioned to male or in some process of transitioning to male. I think that that's a part of the conversation that we don't often have, is for trans men of color and for gender non-conforming folk. Where do they fit in this paradigm shift for us? When we think about access issues, frequently what we find, whether we're working in rural communities in Appalachia or working in Southeast DC, one of the issues that we find often is that it's an issue of awareness, knowledge that PrEP even exists, that it's there. So I think one of the things that we're doing is that we're trying to develop more tools for individuals to be aware of PrEP and to put PrEP messaging in spaces that are more likely to be visited by both gender non-conforming individuals as well as individuals who are women who just don't know that PrEP exists and that PrEP can be for them. Next slide. One of the projects that we were funded from by Gilead to do is the Equitable Access Project, where we wanted to bring frontline providers together for a 2-day meeting to discuss what are the real policy and advocacy issues that impact non-clinical HIV, Hep C, maternal child health, reproductive health providers, and how we could have this conversation. So we reached out to organizations in 14 states, primarily across the southern belt of the United States. And we met in Atlanta, Georgia for 2 days. We did subsequently, next slide, a survey of more than 500, you can skip to the next slide. Thanks. We did a survey of more than 511 individuals to set a series of priorities. And one of the priorities that certainly came out of that survey was that we needed to do more awareness, education, and access, and develop more tools. And we did the survey both during the U.S. Conference on AIDS as well as the 2018 Harm Reduction Conference. And what we did is that we realized that with this survey, we could both give information as well as get information from individuals. Next slide. So the advocacy priorities, and I point out number one was to increase community-based organizations' voices in national HIV Hep C policy decision-making. One of the individuals that we had brought to this 2-day meeting was Cornelius Baker, who is a thought leader and does work around national HIV policy and global HIV policy and Hep C policy. And one of the things that he really brought up to us was that it really wasn't the role or the goal of the national organizations to truly represent the non-clinical providers at the front level, but rather their role was to protect the federal allocation. And when I asked him, well, whose job is it to make sure that these organizations, particularly organizations of color working on the front lines, were protected, he said, it's our job. And so that's why the number 2 priority, advocacy priority, is empower communities and individuals to reduce stigma around HIV, Hep C, PrEP, syringe exchange, and reproductive health. What we realized is that what we also have to do is figure out tools for local organizations to be able to advocate at the local, county, and state level to be able to change rules, change laws, affect waivers that impact them implementing their programs at the community and grassroots level. Next slide. Why Black women need awareness before access. As it says on the slide, you know, as more time goes by, what we realize is, and what we've seen both anecdotally and through 2 different studies, is that many Black women are unaware of PrEP availability. And so what we need to do is, before we can say, take PrEP as a thing, I think we need to educate more Black women and more folks of trans experience and more gender non-conforming folk that there is PrEP out there and what it does and what it doesn't do. Next slide. So what are the priorities? As I said earlier, our priorities are interesting in that we work in, community education group works in 2 very distinct yet different communities. We work deeply in the African American community, and then we work in rural Appalachia. And what we find is often that poor white folk in Appalachia who have been impacted by substance use disorder have a lot of the same challenges that we see in African American communities in urban environments. And what we have to do more and more is figure out what are the strategies to give them the tools in each of these individual communities to be able to implement outreach, to be able to conduct both rapid testing, rapid screenings, but also linking individuals to care. And we have to do it in a way that also supports training individuals to be able to participate in things like clinical trial, protocol review. It's a wide swath of work that we need to do to both train and educate our population to be able to effectively sit at the table and to participate and advocate for themselves. Next slide. One of the big challenges we found about PrEP was that where are the PrEP users in the United States? And this, as you can see, is not broken down by gender, but just an overall, where are the PrEP users? And you can see it's more in the Northeast. As we talk about the South and the impact in the South, in Appalachia, we need to do more outreach and education on PrEP availability and then making PrEP available. Next slide. As you, again, 94% of all PrEP users in 2017 were men. So if that's 94%, we can say roughly 6% were women. But even when we look at, there's a slide from, that's not here right now, but there was a slide that I saw from Gilead that showed that the majority of PrEP users were white women. And that, again, is it an access issue? Is it that white women have more greater access to PrEP? Or is it that there was an awareness issue? And we believe that it was an awareness issue. White women knew that PrEP was more available. So I think we have to do more to change this outcome right here, where it's more women have to just be aware that PrEP is available. Next slide, please. Whew. Pardon me, call to action. As we talked earlier and several people have mentioned, we want to make sure that we can prevent more women, more individuals of trans experience, more Black trans men from acquiring HIV, but we also want to increase prevention. And again, I come back to the way that we want to be able to do that, pardon me, is to make sure that we have awareness so that individuals will know how to access PrEP, but also how to access screening for HIV, Hep C, and to be able to access the maternal and child health services that they need. Next slide. call to action. Actually, one of the things that has happened since COVID-19 and the CARES Act that has come about is that community education group, along with True Evolution in the Inland Empire in California, we have put together a request for what will be called COVID-4. They've now funded 3 versions of the CARES Act. They're now working on COVID-4. And we've asked for a $5 billion request to be included to support organizations that are non-clinical providers in rural communities across the United States to be able to respond rapidly to a future outbreak of COVID, but support telehealth and telemedicine in these communities. And when I say these, this particular request that we've made is specific to rural communities. But in every member that we have met with thus far, and with every federal official that we have spoken with, they want us to expand that to include communities of color that are supporting non-clinical services, particularly to increase linkage and access to care using telehealth and telemedicine. So it's a large infrastructure bill in communities that are rural and communities that are Black and brown. If you haven't signed on to the letter, I hope that you will. We've opened it up and we'll extend it and have extended it to next Monday when we will be meeting with the chair of the Appropriations Committee. Next slide. Thank you. And have one more person to go. I think that Dr. Burns, are we starting with you?
Yes, ma'am.
All
Good
right.
afternoon. Good afternoon. Thank you so much. Next slide. Once again, I'm Dr. Demisha Burns, the Policy and Advocacy Manager for World. Our mission is to improve the lives and health of women, girls, families, and communities affected by HIV and STIs through peer-based education, wellness services, advocacy, and leadership development. What that consists of, a little bit more in depth, but definitely not exhaustive. For our peer advocacy, it's a matter of assisting others with medication adherence, maybe getting people that have fallen out of care back into care, reaching out to those who may need additional support. For example, we have support groups for both our cis and our trans women. Our outreach and linkage works with individuals that may be struggling with opioids in a program called Key Ways, as well as working with PrEP regarding getting people involved into it that may need to, that may express need, may not necessarily have direct access to it. And then our policy and advocacy deals with our leadership committee. We also have a SUN program, Sisters United Now, and we also deal with behavior intervention. So part of that is SISTA, CLE, and Amigas that deals with condom negotiation, assertiveness skills, and other skills that help our women and girls just be able to advocate for themselves in ways that are needed. Additional pieces of that are STI Network, along with a trauma-informed care practice and training that we offer to both our clients, our staff, as well as our community partners and the community in general. One of our big things when we're talking about the roles of women today, just think about it, even ourselves, what roles do we play? And I can guarantee you, even outside of the ones that are posted on the slide, there are several ones that we carry, whether it be a mother, a sister, a daughter, a wife, a partner, whatever it is, a CEO, executive director. And so there are all these different roles that we constantly hold, that we're constantly juggling. And one of the biggest things is whether through an STI, HIV diagnosis, as an advocate or both, a Black woman performs many roles in general. These roles are oftentimes carried out at the expense of her holistic health, unfortunately. And we know that when we're talking about holistic health, we're speaking mentally, physically, emotionally, spiritually, and or financially. Next slide, please. And so one of the biggest things when we talk about community engagement and why is it important, 2 particular areas that we hound on with World is accountability. When we're talking about education and prevention, if we're not having these conversations, if we're not sharing, then who is? our young people, our older people, they're going to be talking to someone. And if we're not doing our part in communicating with one another, then we're missing the mark. Our second piece is communication and awareness. How are we sharing this information? How are we making sure that people are getting the information that they're needed with our communication and awareness, whether it be, those who may not have access through technology and things of that sort? Then are we writing things down? Are we doing some of that old school stuff that people are still in need of, and bringing about that awareness across the board? When it comes to mental health hits across the board with everyone in different realms, whether it might be dealing with depression, might be dealing with post-traumatic stress disorder that also falls under necessity. It may be dealing with schizophrenia, manic disorder. Several things go into it. And so a lot of times, unfortunately, it's overlooked. And especially when we think about mental health, when it comes to the Black community, unfortunately, a lot of us grew up with, hey, pray about it. A lot of us come from, or through that Bible Belt, and a lot of times having that conversation on, we'll pray this through, and which is awesome, in incorporating that higher power. But there are also other things that may need to be addressed or assisted with that. So then the last part, the trauma-informed care practice and training. For some who don't know, we do this training as well for the community. And one of the biggest things that we share is that, especially for women, when we're born, we have the amount of eggs that we're going to have in our life. And if we're not cognizant about it, the trauma that each person experiences is going to go into our eggs, and we do hold on to that. So when they talk about that generational, I don't want to say generational curses, but those generational happenings, then those are things that we have to be aware of, and we have to be cognizant as we're sharing with others. Now, how that goes into necessity, once I said earlier, dealing with post-traumatic stress disorder, those things that have happened. A lot of times we overlook post-traumatic stress disorder, we overlook that trauma, but trauma can come in different ways, and it can depend on where you were born, what that looks like, how you were raised, the various things, that come up. Were you raised in a location that has, you may hear a lot of gunshots? Were you raised in a place that dealt with a lot of racism, oppression? Were you raised in a place where you were supported? So all those things play a part. If we look now, there's a big push going into the next one with gentrification. You look at the communities that we stay in, and I would suggest that most people, if not all, that are listening, and even my co-panelists, would say that things are not the same that it used to be. Our communities are not the same that they used to be. Gentrification is definitely playing a part, even how we talk about housing. Somebody spoke, about that earlier. We have several places, and unfortunately, especially in the Bay Area, we realize that there are locations for people to stay in, and we're also seeing that now, especially with, COVID. We're finding places, for our homeless population, but what happened before? Why couldn't we do that initially? And so when we're thinking about that, thinking about what is happening, housing is being put up, but they're at unaffordable prices. And so from that, then we go into stigma. Just the thought processes, unfortunately, that are associated with HIV, AIDS, even STIs. It is something that literally is killing our community, because, if we have, this continuous stigma, oh my gosh, you have the plague, we're not going to talk to you, that hurts, and that definitely hits that core. And so when we're talking about those access to services, and why community engagement once again is important, because it hits across all those boards, and they really all play a part. Each and every organization that has been talked about, each of my co-panelists that have spoke about the various things that are going on, brings about the importance of us communicating with each other, us working with each other, us realizing, understanding that access to services, that general community engagement is extremely important across the board. Next slide. And so one of our different things that we say, even in the Bay with World, so yes, our big push is for HIV and AIDS, but the reality is exposure to an STI makes one more susceptible to an HIV diagnosis. And although these slides will be further available, just a quick glance on here, it talks about chlamydia, gonorrhea, and then early syphilis. I just want to say a few words about chlamydia. So in the Bay, if you're just looking at that, the red equals female, and then the grayish color is the males. And in that first one that talks about the ages, our highest is 20 to 24 years, followed by 15 to 19 years, followed by 25 to 29 years. This is happening. And so if we're not paying attention, unfortunately, this cycle will continue. Going into the next one, it talks about race. Blacks are at the highest percentage, followed by Latinas. And then in that last one, where it just talks about the years, for the solid deals with the county, and then the dotted line deals with the state. So you'll have the slides that will be available. Just wanted to make sure that everyone was aware that, STIs are definitely on the rise and have been on the rise in the Bay Area, along with other counties throughout the US over the last 5 years consistently. And so wanting to just be cognizant that, hey, we have to talk about the whole picture. And that is definitely another way where community engagement definitely continues to show its importance. Next slide. And so looking at this, some of the things that have already taken place, in that first picture in the top left, it was at the paradigm shift that happened in February. They went through a timeline of activities that started in 2017 with a conversation that started in DC and landed to the ending of the second paradigm shift 2.0. And so one of the things is, it's going to take us having these conversations, signing on to these letters, making things aware of what is going on and continuing on. So I know they're looking at doing a 3.0, in the picture underneath, you'll see this is the executive committee for the paradigm shift, because it is something that is important. And one of the presenters that was there said that this is one of their favorite conferences because it does allow the opportunity for full engagement. It allows the opportunity to just share, with others, Black and Latinos, this is how we're feeling, this is what's going on, this is what is needed. And then from that, an action plan was developed. And so the first one was advocacy and policy, funding and resource development, research, and community health and wellness. So this was the 4 main areas that were taken out of the paradigm shift, just to show, one, how important it is. And it is something that continues, to bottle its head. When we talk about disparities, when we talk about the funding that comes down for the research that is needed, if we're talking about PrEP and the fact that, yes, we have Truvada and we have Descovy, but how many of those tests were actually done on women at a rate, Black women, at a rate that really, really assisted to what is needed. So there are definitely, much more research and things that are needed in regards to the community, in regards to communicating with each other and continuing to work together to make sure that we're looking at that ending in 2030, and we're looking at making those different maneuvers that are needed in order for us all to continue to come together. And then next slide. This is just a general statement that we say in general. I am not my diagnosis. It does not define me. It does not determine my destiny. And so understanding that regardless of whatever the diagnosis is, regardless of what it goes out, HIV and AIDS, they will not overcome us. We can, overcome each and every aspect of it. And this is one of the pieces that I shared last year. And I just wanted to leave everyone with this, just especially in this time that we're going through. And it's called To Be Me. To be me when I speak as to what we agreed, but which me today do I really want to be, or even more so, which me are you really even ready to see? For I can be that young woman that you want me to be, but does that include the reality of he being with me while I'm finding the desire to be with she, or vice versa? No, but they can include the perceived habit of my tattoos or piercings or my sexual acts of promiscuity. And what's monogamy? Misunderstood because I don't know or see or have been told of my true inner beauty, or the fact that I was stripped of my innocence at an age so tender. Yet it's my flirtatious ways, stripping days, and hoish acts that everyone remembers, but that's no excuse. For to be me when I speak as to what we agreed, although in the mathematical equation, two's company and three is a crowd, it was mama, daddy, cousin, and uncle trying to get a piece of me when no one else was around, but I had an attitude when I wanted to be alone because I was quote unquote being rude. But there's no excuse. For to be me when I speak as to what we agreed, so do I expect you to understand that while in church, hearing about the man who has the master plan, that my mind constantly wonders on how that block or that blitz is going to do the trick and give me a mental fix for out of my house I was just kicked. And I'll pay some of the bills, but that's no excuse. But to be me when I speak as to what we agreed, but when I say I do, am I really expected to fall to my knees? Understanding, yes, that two become one, but is it okay to accept mental, physical, emotional, and or sexual abuse all in the name of the sun? While people are constantly turning their heads saying it's not in their beds. And when 911 is called on that fateful day, oh, I knew something horrible was going to happen, even with the paper trail is all they say, but now it's too late. Yet your support, help, or encouraging words could have helped us choose a different fate. but now I'm doing 20 plus upstate. For it was he, she, or I on that day that would die, and I just blacked out and saw red. I can't even lie. But that's no excuse, because I'm the one who called the cops. But to be me when I speak as to what we agreed, yet to have a drink, yet go to or help out in church is wrong indeed, although the hurt inside me no one sees. As I wash it away, the facades put on day by day, for I was always considered a disgrace. Because I was the wrong height, color, diagnosis, profession, musical lesson, wrong voice or partner choice, too high strung or sensitive, or too out the box and menacing. So do I look the same as when I started out? Did you close your ears because you're not ready to hear what I'm talking about? Because I'm here and this is me, but times 3 for the Father, Spirit, and Son got this one. Because they accept me as I am and help prepare me for the Master's plan. For to be me when I speak as to what we agreed, for to be me when I speak as to what we agreed, for to be me when I speak as to what we agreed, and the truth is, they are all realities. I just don't know which one is you, like you don't know which one is me. Community engagement is so important, and this is some of the things that we do. Thank you, from World.
Thank you very much. That was a very powerful piece there, Dr. Burns. You shocked us with that one. You got us good. I want to thank all of the AIDSWatch sponsors. I want to thank my panelists first and foremost. But most importantly is that I want to thank you advocates who are sticking to it and even doing AIDSWatch and doing virtual Hill visits in a time of COVID. I think that Dr. Burns' piece really summed it up, which is, you know, we all wear and have different experiences in this movement, and that's what we are in. We're in a movement, and I think that COVID has really given us a shining light on health disparities in this country. I think that COVID has given us also an opportunity to work more collaboratively and collectively to achieve the needs of our individual communities. And as you heard from our panelists today, they run far and wide, from the need for more STD education, awareness, and treatment, more PrEP awareness, education, and treatment, more involvement of community level folk in policy and advocacy. But I think that we all have a voice. And, you know, I think, you know, I hate to go old school, but, you know, really it's like if we lift every voice, I think we can sing, but we can also have impact. So I will turn it back over. If we have any questions, Laura, if you want to read some of the questions, maybe we can answer them and then close out. And again, thank you everyone for taking time out of your day to participate in this.
Thank you.
Thanks, Tony. My name is Laura Gerson. I'm a program associate here at AIDS United. And yeah, I'm going to read a couple of questions that were posted in the chat. The first one is for the BWHI folks, and that is, where can we access the Luna comic?
Thank you for that question. We're actually getting ready to update the website where there can be orders placed in bulk or individually. So stay tuned for that.
Great. And Tony, you raised some great points about COVID-19. And one question that came up was, how can we help Black women living with HIV during this COVID-19 pandemic?
Well, I think that the issue of Black women, HIV, and COVID is that we have to make sure individuals understand that living with HIV is an underlying condition, and that we prioritize Black women, particularly Black women who are frontline workers, Black women who are healthcare professionals, Black women who may not have the luxury to stay at home. And I don't like the term shelter in place because it really reminds me and refers to when there's an active shooting. But I think that when we have to make a choice to do physical distancing from one another, we have to take into account that there are many Black women Black families and Black women who are head of household who don't have the luxury for physical distancing. They have to go out and work. And I think that that's the thing that we can do. Everything from making sure those women who I see as warriors have food, do they have childcare given that schools are closed? What can we do to support our network of individuals that we know? I think that that's the thing with COVID. COVID is a very localized, regionalized thing that we must respond to in a village sort of way. Whether that woman is a postal worker or a doctor in an ER, we need to check on her and check on her family.
Absolutely. Couldn't agree more. We have to be prioritizing our heroes. The next question I want to ask the group is, how does the argument that Black men, implicitly heterosexual and non-men who have sex with men, need to be prioritized for PrEP education and access relate to the fact that routine STI testing of heterosexual non-MSM men has not been found cost-effective or to reduce STI transmission who have sex with men?
Yeah, this is Tony, and I'm going to answer that because I think that question was somewhat directed toward me in a statement that I made about the need to include Black men in our conversation around PrEP awareness. I think that I really have a core belief that we don't have a lot of spaces for Black women and Black men to have a couples dialogue. And that couple, I think, is often the thing that gets misidentified, right? We don't know, how an individual defines monogamy for themselves. We don't know about discordant couples. We don't know enough about how it is that Black women want to have a conversation about PrEP utilization with their partner. And that's why we need to include Black men in this dialogue more. We need to increase screening of men who identify themselves as heterosexual for HIV, STIs, and as well as just getting them involved in this conversation. Because I think when we don't do that, we kind of miss who Black women are. Black women have a greater likelihood to have sexual relationships and have their social, sexual, religious, and familial network to be inclusive of Black men. And if we don't include them in this conversation around sexual health, risk reduction, education on PrEP and other tools that are available, often we are missing an opportunity to also engage women because they're in relationship with men.
Absolutely. Sort of building off of that, as we look at the engagement of Black women of all backgrounds, what do we really need to be focusing on as it relates to PrEP access, particularly for Black trans women?
Well, that seems like it's me again. I think that again, I come back to awareness, awareness, awareness. We have to put messaging in venues and spaces that are not just clinics and not just church basements, and frankly, not just on our websites. We have to do a deeper dive into where Black women congregate, where Black women educate themselves about what is PrEP, what it does and what it doesn't do. I think that one of the challenges that we have is that I will call them missteps with the Descovy trial. What it did is I think it put some people in a mind frame of, well, PrEP is a bad thing and Descovy is a bad thing. And I don't, that wasn't my takeaway. My takeaway from what happened with the Descovy trial was that there's clearly a critical need for us to educate and involve Black women in the clinical trial and drug development process. I think that that's the real kind of misstep there was, while individuals may serve on an ad board or be, the contact person for a company or an organization, it's important that we have an educated core of Black women who are sitting at tables to review protocols, to say no to protocols, and that there's a network of them so that it's not one person saying it, but there's an educated and trained voice to say it and respond to what is needed in the scientific realm as well. I'm not saying that there aren't Black women researchers out there doing both behavioral and clinical research on PrEP, but we need a community that is equally as educated and ready to share voice as well.
Thank you so much, Tony. I think that is an absolutely correct answer. I've got one final question in the chat, which it came up a bit in Dr. Burns, your presentation. How would you encourage Black women to deal with or begin to address issues related to trauma and PTSD that seem to continue?
Thank you for that question. I think one of the biggest things is communication. So often we were raised in places, hey, what's done in that house stays in this house, stop putting your business out there. And unfortunately, especially when it comes to Black women, we often sometimes deal with colorism as well. But one of the biggest things is that we need to find allies in and among, with ourselves, with others, and reach out and really communicate about what's going on. The reality is when we don't create something or allow it to become normal, a normal part of that conversation, then it becomes taboo, and so then our younger ladies that are coming up, then they feel as though, well, I can't talk about this, this was never anything that was talked about. Or even some of our, older women, they'll tell you, we never talked about that in our house. I'm not going to talk about that with my child or my grandchild, and so it's changing that, it's changing that conversation and saying it is okay to talk about these various things. It is okay to talk about if somebody is, if somebody has touched you wrong. It is okay to talk about if somebody has said something to you, that is not appropriate. It's okay with, allowing yourself to be beautiful, to be smart. A lot of times, as women, a lot of times as Black women, we are taught to, hey, sometimes stay under their radar. You don't really want to share how smart you are. You don't want to share how beautiful you are. And the reality is we are all beautiful in and out. We all have different gifts and talents, that we have been given. And, a lot of times we don't realize that it is not a competition. It's not, you versus me. It's not your organization versus my organization. It's how can we help, to lift up each organization? How can we help to lift up each person? Because the reality is you're going to be able to reach somebody that I'm not going to be able to. You're going to be able to have that impact that I'm not, and so understanding that trauma hits each and every one of us, it's important to start acknowledging those things, having a conversation, reach out to somebody that you feel, won't judge you. A lot of times we come things in a judgmental manner, and it's about realizing that, we all have our various things that we're dealing with. So technically, if we want to be, real, nobody has a place to judge anyone else. It's about how do we help each other, get ourselves out the way, and how do we support the next person that's coming up, instead of thinking, well, I can help you because then that means you're going to take my spot, or that means you're going to be better, at this than I am. And the reality is we want to help better each other, so that ultimately we all can grow from this. Ultimately, we all can move forward. And if we're not addressing those issues of trauma, then unfortunately it's perpetuating itself, and we see it, in our different communities, where it may have started with the female, but if truth be told, our womb is the birth, and so it will then impact our men, you know, and so we have a responsibility as a whole. But I think that the initial piece, as far as starting, is literally just having that conversation and talking to someone, and making it a reality, you know. So I think that that's where we start. And then as we continue to have those conversations, we can continue to battle and push down these walls, you know, and move forward as a whole collectively. Because individually, you know, we're stuck, but collectively we will definitely build and can definitely grow together.
Thank you so much. If anyone else has anything they would like to add, feel free, but I do believe that that was the last question we have in the chat.
Yes, this is Tammy. I think to sort of underscore what I think many of the folks talked about in their presentations, that it's definitely important to for Black women to have a seat at the table on policy and engaging their elected officials, whether it's at the state level, local level, or at the federal level. Many of the things we talked about today, you know, they're great that we can, you know, we talk about many of these, you know, different ideas and several of the challenges faced by Black women, but unless we empower Black women to have a seat at the table, to reach out to their representatives, then, you know, we can't really make, you know, really effective and substantial change around many of these areas. So just really want to say that we need to encourage and empower folks to reach out to their elected officials and get involved in the process.
Sure. I would also, I guess in continuation of what Kanita was saying, was making sure, as we stated before, make sure that we're involved in the census. Census is attached to funding, and so making sure that we are part of that count. And then as well as voting how we have 2020 that is coming up, making sure that our voices are heard. And so that is very, very important for us to do as well while sitting at the table, or in addition to sitting at the table.
Yes, this is Kanita, and I would just like to echo that statement. Yes, voting. It's important to vote for the presidency, but also just echoing Tammy's statements as well, to vote on a state and local level. Due to the coronavirus, it's never been more apparent that the policies of your state and local governments, whether they're aligned with your interests, can really truly be a matter of life or death. And also, again, the census. Please be counted and submit the census forms. It determines, you know, how many seats you have in the U.S. House of Representatives for your state. It's used to draw congressional and state legislative districts and school districts, and determines your federal funding for your state, which all, whether it's directly or indirectly, has an impact or can have an impact on HIV funding and legislation. So please get out the vote and complete the census. Thank you.
Nikisha, do you have any closing remarks?
I think you all have covered it all, but just to kind of just echo it all is that we are who we've been waiting for, as cliche as it may sound. So, you know, these conversations around HIV and, you know, whose responsibility is it? I think we all have a part to play in being informed, staying informed, as Tammy said, being involved in the legislative process to ensure that funding is allocated for Black women in this epidemic. So yeah, we all have a part to play, whether we're living with HIV or not.
Thank you. Thank you, everyone. Everyone has summed it up nicely. Thank you, AIDS United, and thank you, AIDSWatch, for the opportunity. On behalf of my panelists and myself, I hope that everyone got something out of this, and the slides will be made available as well as the audio. Thank you very much.